So what is the role of the healthcare system in Australia? Well, we're looking at prevention, promotion, diagnosis, treatment, and rehabilitation. Okay, those 5 aspects cover pretty much everything of healthcare in Australia. We do have 2 different types of care in Australia. We call them institutional and non-institutional care. The easiest way to remember this is institutional care means that you can stay overnight. Okay, so think hospitals, nursing homes, aged care facilities, specialist clinics, like sleep study clinics, etc. Non-institutional care is basically day services, GPs, physios, dentists, etc. So looking at equity of access to healthcare in Australia, we do have a pretty good system. It could be better. Medicare and PBS do an amazing job as to making sure that everyone can get public health in Australia, all right? Either through subsidising care, treatment, diagnosis, or also medications, etc. However, we could improve through things like geographic location, gap fees, wait times, and systemic racism specifically for First Nations peoples. How do we address these? Well, geographic location, we could have more mobile services, more infrastructure built in rural and remote locations. Gap fees could be reduced by increasing the amount that Medicare do support, or by simply having more private institutional care. It will lower the cost because there are more options available. That will go along with wait times, and systemic racism is going to be through ongoing education and training. So some future opportunities to improve the healthcare system, definitely expanding telehealth and alongside a improved digital health portfolio is going to help. So not only are more people, especially in those rural and remote locations, able to access care, but they're able to access care like immediately as opposed to waiting days or even weeks to talk to a doctor or see a specialist. Increasing the aid of CHS for culturally safe healthcare for First Nations peoples so that they feel there is no racism barrier for them accessing care and no judgment. And improving NDIS support for all the people in Australia that require NDIS, specifically including more disabilities in that eligibility list. And that was your too long didn't study version of the effectiveness of the healthcare system in Australia.